Hello, all. This is Dr. Dheeraj Masapu. I'm a senior consultant in the field of neuroanesthesiology, and today we have Dr. Ridima, and she has done a DA and DNB in anesthesia from Wakad Hospital, Mumbai. After that, she decided to settle in UK. Okay, and then she explored different options to settle in UK. And in the process, she even came and met me in Astor Whitefield in Bangalore. And then after that, what happened is now she decided, or at least she is thinking, not to go to UK and better to stay in India. So let us hear her story from herself. So welcome to the channel, Dr. Ridima.
Hello, sir. Thank you for having me here, sir. It's always a
Mhm.
pleasure meeting you and speaking to you.
So we want to know your story, starting from why actually you wanted to settle in UK to your decision of at least your thinking in the direction of not going and settling in India. So how did this whole thing happen?
So when I was doing my diploma, I we were really fresh into anesthesia, and a lot of my seniors were considering moving to UK. So they were finding out about the vigorous exams processes to go there. And the what we hear very commonly and through DNB also, when I interacted with consultants who had returned from any sort of foreign training, everybody was very encouraging of all of us to go there and experience that work culture. So somewhere it started growing in my mind that I should go and experience that and see what this whole thing is about, why everybody is speaking so highly. What is it that they are doing differently that we are not doing here? And if there is something new that I can learn, then it is better that I do it at an earlier stage in my career, fresh after my diploma and my DNB, because it is easier to pick up things when you are fresh out of passing out post an exam and with a degree. There is still some scope for learning, so it is easier at that point to pick things up. You're faster at gripping things. You're spending more hours in a hospital because you're at a relatively junior post, so it becomes easier to understand the working pattern. And I wanted to see what is the entire hype about the West. Ever since we got into our MBBS training and postgraduate training, it was all about the West, the work in the West, the research, the way they do cases, the way they manage patients. So I was very curious to know what they are doing, and that is where I decided that I want to go for training there and I want to see what it is. US, when after post graduation, the path is slightly difficult because you have to give the USMLE exams. And I didn't, after reading anesthesia for 6 years, I didn't want to really start off again with anatomy, biochemistry, and go back to that. So I decided that UK is also a very good option because they have a process through which you can directly get a job there through the MTI pathway. And some of their clinical posts also open up for international training fellows, where they directly recruit from different countries. So I thought, and a few of my seniors went through these pathways, through the alternative pathways. Now the MTI has really reduced its seats, so the intake is slightly lesser. The posts that come out and that are advertised through MTI is slightly lesser. The government has regulated that they are almost trying to phase it out. In a few years, it probably might not even be there. So that is why now there are direct posts which you can apply for. So I started the entire process of giving the OET exam, and also, applying for this post. And I kept applying through the entire year, but I did not get any positive response for a job interview. And multiple times over I tried correcting my resume. So the way of application is you just have to upload your resume in a given format by the NHS portal. So the NHS portal has a resume format where they ask you questions about your qualifications, work experience, teaching experience, research experience, and whatever you have done in your career, you have to put it down there and you have to write a statement of purpose. And for every trust, it is the same resume. There is no difference. So, with certain alterations in the statement of purpose, of course, with in regard to trust values, you can apply that way. So I was doing it for a year as and when the posts were coming out, but I was not hearing from anybody. And effectively, you really can't change your resume. It is what it is. So, and even if you're trying to change it, it will take some time. You will have to show 6 months of certain work experience, maybe a branded hospital that you're working in, maybe doing a research, but even publishing a paper will take some time. So, over the course of 1 year, I tried doing all of those things and I tried applying, changing the CV multiple times, bettering it, but I was not hearing. And I was asking my seniors who have got through these pathways what was going wrong. I was trying to get guidance from them how I could improve so that I get an interview. Basically, uprooted your entire life and you've gone there and now you have to be there. Because you have going is also not easy. It takes time. There is a lot of patience that's required. There's a lot of an interview. So that becomes aware. If you don't like it, you still have to be there because you have a contract. So the observership, how it became very beneficial is you don't have a long duration contract, but you get an idea of what they're doing and whether that system works for you or it doesn't work for you. So then I started applying for observerships. Also, observerships over there, they have a lot of value. This is something you told me because I was not aware. Because in India, we don't really have that much of a trend of observerships, even in our post graduation and after post graduation also. So you suggested that I should do that, and I started finding out about it, and then I started applying for the observerships. I landed observerships in Manchester and in London, and I went for those observerships. And when I spent 2 months there during that time doing the observership, I realized that this probably wasn't for me. And it was good that before I moved with bag and baggage on a permanent basis, I got a snapshot of what is happening here and really actually how different it is from what we are doing back home. And then when I experienced it firsthand, I came back, decided that I would want to probably be in India. So I think that observership really cleared a lot of things for me.
So this observership, what you're telling is a paid observership or is it a free observership?
Sir, it is not a paid In fact, we have to pay
Yeah, that's
a
what
fees
you
to
have to
do the
pay. That's
observation.
what I
Yeah,
meant.
but they don't pay
What
anything,
is
but
the
they do give a certificate at the end of the observership stating that you have worked in this department under so and so consultant and from so and so duration. So you have some kind of certification from there. So even when you come back, if you are reflecting it on your resume, it may hold some value when you're going for jobs, etc. in India when you're applying, that you have some experience. They do give you a
yeah.
written thing that you have
No,
experience.
when we are doing interviews, we will see all these observerships. Who has some international observership would carry a lot of value. Then there is no doubt
Hmm.
in that. So my question is, so what made you decide now to settle in India? We'll come to the point.
Yeah, sir, actually, the thing is, there are lots of angles in which I thought and I considered. It was like 2 months every day. I was only thinking about whether this is better or that is better. For 2 months, it was straight. While I was there, my mind was only working in this direction. There are quite a few reasons. So, work wise, if we speak, work wise, I feel like skill set wise, Indians are far better, I would feel, because in my understanding, we have the numbers. So, even though their residency period in anesthesia is 7 years, ours is 3 years, we are doing work in 3 years that they do in 7 years because surely of the volumes that we have, whether it is a MD, whether it is a DNB, whether it is a diploma, whether it is a private institute, government college, corporate hospital, the kind of numbers that we are generating in this country makes us very, very good in our skill set. So that was one thing that I noticed, which was different. Secondly, sir, clinically also our assessment and our judgment of the situation is a little, I felt we are less dependent on investigations and more clinically adept to see how a patient is responding and alter. That probably could be because we are a developing nation and most of our patients are below poverty line. So everybody cannot afford a CT scan worth 15,000 rupees. So our clinical assessment becomes better. I don't know what the reason is. Either it is workload or circumstances, but clinically I felt we were better. Second thing I felt is, sir, I have trained mostly in Maharashtra, and most of it has been in Mumbai. Now, but I know for a fact that residency across India is very fast paced. There is a lot of work for us to do. We're constantly on the move. We're constantly doing cases. Most of our time is spent in a hospital. Even post residency at SR level, at clinical associate level, there is a lot of work that we are doing. When I went there, I suddenly started feeling that the pace was not matching what I am used to because it was very slow. An 8 o'clock case also over there will not get induced before 9:30. So the patient walks in at 9:30 into your anesthesia room, and then by the time they position and things like that, yes, their surgeons are fast, agreed. But then the morning 1.5 hour that you're there, you're only sitting and countlessly having cups of coffee. So I felt like that was very boring for me because I am used to taking a patient at 8 and giving the patient over to the surgeon at 8:30. So it was just not matching that till 9:30. What are we doing here? So I kind of felt that that pace and the volume was not matching what I was looking for. I personally am somebody who enjoys anesthesia. I like spending time in an OT. That is not a problem for me. I will not crib if you put me in an OT for 24 hours straight also. If the case is interesting, if there's something new to learn, I'm okay. Even if it is not interesting, but I've got my spinal in the first shot or I've intubated well, I'm happy. If I'm doing my procedures, the vitals are fine, I'll be happy to be in an OT. So I was finding it very very
Boring.
weird that I'm not spending as much time in an OT and I'm spending more time in the coffee room because the patient is just not coming. Or we are used to doing 4 to 5 cases in 8 hours, medium size, maybe like 1.5, 2 hours cases. There they have very strict rules where they will not do more than two, or they are not able to do more than 2 cases a day, 2 or 3 cases a day. So I was fine, and sometimes it's not even 2 cases. So I was feeling very bored to so to speak in that. So I decided that that was one thing. The work pace was not matching what we are trained for over here. We are trained to
Action.
turn over quickly.
Action is action.
There,
Ours is
yeah, there it is very slow, sir. It is very slow. So
need.
somehow you also end up becoming slow if you are in that system. And I felt like long term I don't want to slow down because if I start, this is the early phase of my career. Now only if I am not investing time in developing my skill set and being in an OT and learning at this point, later it is going to be very difficult. So it is better that you spend more time and give more time to this right now than later. And if you move there at this stage, you're going to slow down, which was something that I didn't want because I felt like long term sustainability of that, how good you might be, is questionable. Uh, I feel our training works because the more time you spend, the better you get.
But
That's how
I'll tell you
anesthesia is.
actually why people go to UK is you get, see, financially you'll almost even if you become a consultant in India you'll earn the same, but the thing is the work life balance, the the kind of laid back life you can have there is
Yeah.
the attraction basically.
Yeah, yeah. Sir, but I felt one thing. I realized one thing because I was there for 2 months and I was cooking on my own and doing my groceries on my own, laundry on my. I also thought of this from a personal point of view. Uh, Sir, what I realized is that everywhere in the world you have to work 12 hours. Whether it is India, whether it is UK, whether it is US, whether it is Australia, you have to work 12 hours. Only the nature of your work is going to change. Maybe in the West, you are going to be in your OT from 8 to 4 or 5. But after that, what is happening is you are going to have to devote all your time to domestic chores. Whereas in India, the difference is you will be in the hospital maybe 12 hours, like all of us are doing duties and our OTs go on for 12 hours. So we are in the hospital 12 hours, but when we come home, we have fresh food on the table because we have services, we have help. Also, speaking from it, keeping in mind that we are from privileged backgrounds. Privilege could be keeping a staff or even having your parents. I realized that even that is a huge privilege which you might not have in the West because your family might not be able to come there with you because of the immigration laws, and also that the healthcare system there is not going to be accessible to your aging parents, and also the fact that the weather is not so comfortable that our parents at this age might adjust to moving there with you so that they can be of help to you or you could be of help to them. So in that sense you're going to be alone over there with maybe your spouse or children or whatever, but then your responsibilities are going to be increasing there because you have no help for literally anything. I in fact I had a very interesting encounter with one of the consultants in UK which I would like to share. I was doing a case with one of an Indian consultant, Dr. Neeraj Bhardwaj in Manchester, and he told me that, you know, why are you coming here? You should go back to India. India is the place to be. He had trained from AIMS and then moved to UK in the early part of his career. And he asked me a very interesting question. He's like, how many times in a month do you clean your car? And I said, sir, every day it gets cleaned. And he said that here I clean my car once a year. And that also I have to do it. Nobody comes to help me out to do the cleaning of the car. And then he was very nice enough to actually give me a lift till the bus stop. And I sat in his car and I saw that the car is actually dirty. So he was right when he was saying that he himself has to do everything. And I realized that the privileges that we have in this country, when we have them, we are not understanding what privileges we have and what we are ready to forego to go there only so that we can cook and do things. I'm not saying that's bad. I'm not saying that's not right and you should not do that. You should do that. You should do it here also if you have the time. But whether that was what I wanted to do, no, because it was not my comfort zone. I am not trained to do domestic chores. It's not something that I want to do. I'd rather spend 12 hours in an OT than spend time like that. So that is one thing from my personal point of view also. I understood that,
What I'm
you
feeling
know.
is working for a little extra time in OT is better than coming home and doing all these things, actually. That is
Sir,
true.
100%, because the thing is, we also with medicine, it happens that doctors, apart from medicine, really, to be very honest, aren't very great at other things, whether it is investing, whether it is finances, whether it is domestic chores, because all of our time and energy during our training and early phases goes into practice, learning the skill set and managing patients, and it goes in the hospital. Now at these age you tell us to start doing these kind of things, it's a little bit of a struggle, and then you're doing it alone. There is no help, no one is guiding you. So then I felt like I don't want to get into that. The operation theater is my comfort zone, so I'd rather spend my time there.
Actually, this perspective till now no one has told me. This is the first time I'm hearing to this kind of a perspective. But I totally relate to this because for me personally, if you tell me to stay in OT for another 3 4 hours, I'm okay. But after
Yeah.
coming home, if you give me some 10 works, it is very tough for me to do.
That I also realized that these are neglected privileges, and you remember everything when you don't have it. That is when you think about your house help also. That is when you think about your parents also, because now I stay with my parents. So for me it is not like I literally just don't have to think about food, whether the vegetables are over or not. There you have to do your groceries on your own, your laundry on your own. So then I thought that what is the need? like to do this.
Perfect. So this perspective actually no one has given. So what I was thinking is actually, see, only reason I recommend people to go to UK is for two things. Number one is if you have a UK exposure, when you come back to go to Middle East from there. See, for
Yeah.
that even you have to be a consultant. Only
Yes,
experience
sir.
wouldn't be enough. You have to be consultant in UK with a CCT or
Yes.
CESR route, which is coming up now. But CCT would be
Yes.
valued more than CESR. So for the CCT again, 7 years you have to work there.
Yes. And so the
Training
other
as well.
thing for CCT, I realized I spoke to the trainees there while we were on our duty, and they for FRCA, if you just so there are two. What I found out was either you give EDAC Part 1, Part 2, get the GMC, go there for a job, and then give the final FRCA because EDAC Part 1, Part 2 is the primary FRCA equivalent. But with the final FRCA, you only if you give only the final FRCA along with EDAC, what they told me is you cannot get into training. You will just get the FRCA degree, but you can't get into training.
Mm.
If you want to get into training, you compulsorily have to give the first part of FRCA.
Mm.
And once you clear the first part, you get into training, and then along those years you can give the second part, and then so effectively, if you do want a CCT, you have to give the first part of FRCA.
Okay.
Even if you have given the EDAC, you can't skip that. You have
EDAC,
to give it.
EDAC will give you a GMC registration basically.
Yes, it will give you a GMC, but you can't get into training with
Training you can't
the
get it.
final FRCA. Yeah.
So training is like ST from you have to start from ST1 or ST2, I think, and should go till ST7. It will take seven
Yes.
years to 8 years,
Yes, sir.
depending upon
Yes, sir.
individual.
Uh,
That's a very long.
Another thing I felt was, sir, that see, we have the highest degrees that are required for our country. We have a DNB, we have an MD. Why do you want to go to another system and start from scratch?
And
What is it extra that that system is offering you that your country is not? This is why I wanted to go there. But when I went for the observership, I realized that they are really not offering anything extra
but
that
ma'am,
I should put in those 5 years because, sir, the thing is, I've done my DNB from a corporate hospital, and today in Mumbai, Bangalore, Delhi, and all the corporates, Chennai, etc., wherever we have corporate hospitals, the equipment, the infrastructure for anesthesia that is there in these hospitals is at par or even better than what they are using there. There is nothing different that they are doing over there. In terms of straight away, if I have to talk about a GA case, we are using Magrath over here in Mumbai. They are also using Magrath. So for laryngoscopy, but the difference is their trainees are intubating every patient, whether it is whether it is an MPC1, a CL1, airway. There is no question of airway. Whatever the airway might be, they are going to intubate with Magrath. But for us, the thing which gives us a little bit of edges, if it is a straightforward and if it is a simple intubation, we are trained to do a traditional laryngoscopy. We know how to do traditional laryngoscopy as well, and we have developed a skill set to do video laryngoscopy as well. So we are actually encompassing the entire spectrum of handling a situation. So we are not that is why I felt skill set wise, if we go there, we are never going to be in a position where we don't know how to do something. We will know how to do some more than what is required because we are training across all spectrums. Because today in India, that infrastructure is available. Maybe 5 years, 8 years, 10 years back, I don't know what the situation was. But today, when we have trained, we have the best machines, we have Dragger, we have Datex Wemda, we are at par. So I don't see what certain techniques of theirs which they are doing are different, but their anesthesia, speaking only anesthesia wise, their patient population is also different from our patient population. The patient's expectations are also different. So the way they tailor their anesthesia is also different. And any case can be done in different ways. Nobody is right and nobody, there is no one particular fixed way of doing a case. If we are talking about a simple total knee replacement, a bilateral total knee replacement, in India usually the trend would be to do a spinal anesthesia with an epidural, and if the surgeon wants to keep the epidural, that's fine. Otherwise, post operatively remove the epidural, put bilateral adductor canal blocks, right? Over there, so because we are more into regional anesthesia as such, there what they do is they think about the patient's experience. Basically, sir, what I realized is their anesthesia is centered around patient experience. The patient should not be frightened, the patient should not be in pain, and the patient should not have a bad memory or a bad experience. Because if the patient has a bad experience, probably medico legally it could be a problem for them. Whereas so because their population is such, also our population, patient population is extremely trusting. They come with faith, so they will, it will be very common for us to hear from our patients that do whatever is best, whatever you think is best for me, you do that, when we are going to consent for anesthesia. Whereas over there, they, when I was going for rounds for consenting, I would see that they would explain the benefits and harm risks of both the types of anesthesia, and then ask the patient, what do you want? And then the patient would tell them what the patient requires.
Correct.
And I felt that uh, their patient expectations were such that they had to tailor it like that. But it became more like walking in, their anesthesia I felt is more like going into a five-star hotel, and the patient has an expectation of a certain experience, and then the doctors are going to do everything to deliver that experience, which is not wrong because that is how their patients are. But our anesthesia in India is more like patients walking into a temple. They know there is going to be pushing, rush, long queues, everything, but they have come for faith. So they know that there'll be little bit of pain, discomfort, but they put up with all of that because they have that faith that we are doing the best that we think is for them. So neither of the things are wrong. It is just that what kind of a patient you are catering to. This is what I felt was a very, very big difference uh, in how the cases were done over there. They would do a bilateral total knee replacement under GA, whereas there was no indication for GA. So I asked the consultant there, why are you giving general anesthesia? So he told me that 5 hours this patient is going to be in a different sleeping position. It will get very uncomfortable, and they'll hear the sounds of the drill, so they'll get very scared. So that experience will be very traumatic for them. Now that was also a very valid justification to me. It is correct. They are thinking about the patient's experience, that the patient should have a very pleasant experience in OT. So, but then again, our training has been that if we can get away without fiddling with the airway, why?
Mm.
Do something like that. So at this point of time, rationalizing was becoming a little difficult for me. Uh,
Our patients don't expect that kind of counseling also. If you go to
yes, sir, exactly.
if you tell them these are the options, what do you choose? They'll look at you like this. Arey yaar, I came to hospital and this fellow is asking me only what to do.
Yes, sir. So they'll judge you for your skill set and they'll say that this doctor doesn't know anything. And at one point, I was also feeling over there when they were doing that. I was like, if we are studying so hard, why are we asking the patient what? We should be counseling the patient that this is the best route for
Correct.
you.
Correct.
And this is what your history is, and this is my experience. Why is the patient telling me what I have to deliver? What if this is not safe?
Yes.
And but the patient wants this, then the patient is also at risk and I am also at risk. So somewhere it
Exactly.
became difficult for
I
me to
think
rationalize
total confusion
their method.
actually.
Yeah, it is confusing, sir. It is
Better way is to
confusing.
give only one option and you decide because you are the subject matter expert and they can ask
Yeah,
the risk in that you tell. This is the percentage of risk.
yeah,
So it should
yeah.
there wouldn't be any confusion on this strategy.
Yeah.
Super.
Sir, there
Very good
they
perspective
are
for you
doing the
actually.
process differently. No, sir, actually, if you go there before your postgraduate training, probably it is easier to adapt because I realized if you go there after MBBS, it is probably easier to adapt because you're taught in that way only from the beginning. So from the beginning, you have seen that only. There is no other way about it for you, right? But after you have trained in India, then trying to ration, and you have done a case like that a certain way, and you have gotten through with it successfully with maintaining patient safety, then accepting that format of working, it takes time. It's not impossible, but it takes time. That is what I felt.
Super. So these are the reasons for you not going to UK. But here
Yes.
one question I would like to ask you: when you decided to go, what are the different
Yes.
ways you thought you can actually go? Like MDI, you already told, and it is
Yes.
not going to work out in future, is what you told me. And senior clinical fellow is the other way, right?
Yes, sir.
And specialty doctor, middle grade specialty doctors.
Yes, sir. So I was applying to so there are NHS jobs, track jobs. These are the websites where you can start applying. You make an account over there, and then the vacancies open up. Once the vacancies open up, you can start applying on those portals by uploading your resume. And then through those portals, you get emails whether you have landed an interview or not. So this was one way that I was trying to apply, but I was not finding any success. So I was getting very upset that I'm not getting an interview call also. Forget
Why is that so?
getting the
They
job.
say
I'm
there is a lot of scarcity in UK, but when you apply, you are not getting any call, right? Many people told me.
Yes, sir. So the problem is I found out over there because when I went there, I asked the consultants there what is wrong with my resume, why am I not getting an interview? So they told me they when their resume goes, when you upload a resume on NHS jobs, it goes to the HR, and there is a 20-point system. So they give you points for each answer that you have written. And among those points, GMC and UK experience has 2 points each. So out of 20 points, Indians will end up not having 4 points straight away if they are applying from India, because you don't have 2 points of GMC and you don't have 2 points of UK experience. So straight away you are behind the race by 4 points. Now, within that 16 points, your resume has to be exceptional, where you have to have a lot of research papers, you have to have some professional, like some teaching experience which is valid. So those kind of things are required where you can score points. The thing that happens is, again, first the form goes to HR department. If you don't have a GMC, they don't even forward it to the consultant.
Okay.
So sometimes what happens is you could have all the experience, you could have done multiple research papers, you could have qualified and graduated from AIMS probably, you could have had a degree in teaching anesthesia and still not get an interview. You could have cleared your OET and still not get an interview call. And that is because the form is not reaching the consultant at all. It is getting filtered out at the HR level because of the GMC registration, and the HR managers are not qualified doctors, so they don't know anything about anesthesia. So when they are seeing your form, the only things they see is the GMC number, whether you have a even driving license. If you have a UK driving license, the UK driving license almost holds 5 to 6 points. So,
Really?
and for some jobs, it is an essential criteria. So, if you don't have these things, they don't even they see those numbers. If they don't have see the GMC number, they don't forward the form ahead. So that is why when I went there, this is something I realized.
So here, IDAC, if you have, you can get a GMC number, right?
Yes, sir. So
So,
once you get the EDAC, you get the GMC number and you get a degree. EDAC is a degree. So you
correct.
get that degree also on your CV, which is not like which is from the West, from Europe. Then that CV starts getting forwarded to the consultants, and then probably if you're shortlisted, you are scoring on the points system, then you can get through with an interview and get an interview. So getting the interview was the first task. Second thing was, sir, the other ways, there are a lot of programs which are now recruiting international training fellows.
Hmm.
So, where now certain trusts have the license to sponsor GMC registration for you, but you will be recruited as an international training post.
Okay.
So you have to, and these jobs are also advertised on NHS jobs only. So only certain trusts have this access, because to get this license to be able to sponsor your GMC, they have to pay the UK government a huge amount of money. So most trusts don't do it because if they can get people who are having a GMC registration, why they want to pay the government for more money, right? So certain trusts don't have this license, but certain trusts do. So you have to look out in the essential criterias in the form whether they require a GMC number or not. If essential criteria states that a GMC number should be there, then you will not get an interview irrespective of what you might be, whatever you might have achieved in your country. So that becomes a problem there. So if you look out for the trusts which have international training fellows, probably or fellowship schemes, you probably can land an interview.
Got it. Got
So
it.
that is one pathway. The other is this MED pathway, which also I had applied.
Hmm.
The MED pathway also it is by Edge Hill University, and Edge Hill University has tied up with certain trusts around Greater Manchester, and they also have the license to sponsor GMC. So every year they come down to India and they conduct interviews. You can apply. You just have to send in your resume, you apply, and then you go for the face to face interview. And I had gone for that as well. I had got through over that, but the problem with that fellowship, it is a 2 year course. They sponsor your GMC, they sponsor a tier 2 visa as well. But the problem with that course is it is a very expensive course, because you are going for a course for 35,000 pounds, which somewhere is translating to around 37 lakh rupees in today's times, out of which 17.5 lakh rupees has to be paid first. Once you pay that, they start your paperwork, they send you the certificate of sponsorship, and then you go there, and once they start paying you a salary, you go there at ST2, ST3 level. So your base pay salary would be around 40,000 pounds a year in the first year, and second year it would be around 55,000 pounds a year. But then the add-ons of the additional call hours, everything will be added. So it works out to about 50,000 pounds in the first year and about 70,000 pounds in the second year. And from that, they start deducting the balance 17,000 pounds of the fees.
Okay.
So again, when you go through this program, you're able to live comfortably, but just about that. You're not going to make money, because 1,000 pounds, 1,200, 1,500 pounds every month will start going as a part of the balance fee to the trust. So
Hmm.
again, that becomes a very expensive pathway to go to the UK. And it doesn't offer any additional benefit except for the fact that you will get a GMC, you will get a tier 2 visa, and after that, getting a job will be easy. And probably sometimes you might get a job in the same trust as well. One of my batchmates, she went through this pathway, and she was offered a job in the same trust after her course got over. But she also decided to come back. She also spent 2 years there. She got the MEd fellowship, and she's come back to India now.
Which
So,
area did she do?
sir, anesthetist. She was also an anesthetist.
Okay, fine.
Yeah.
So superb. MTI, so MED is still possible if somebody wants.
It is still possible, but it is expensive, sir. Like if you can afford it, it's the fastest way to get there if you can afford it. Yes.
Got it. Understood. But you'll get back your money finally after going there.
Yes, sir, you can recover the money, not over the first 2 years, but definitely afterwards, when you get a job, then you can recover the money. Yes.
Got it. Got it. Got it. So then we discussed actually all the possible ways and why you decided. So then, so what is your next plan now? Since you
Sir,
have
so now I'm back in
to say.
Mumbai only, and I'm looking at fellowships in India.
Okay.
What has always been a area of my interest is obstetric anesthesia. Again, the thing here is our patient population is not very trusting with the labor epidurals.
Hmm.
But I feel like in with our generation that is going to change, because everybody is now looking at painless labor. So there is a lot of scope in obstetric analgesia, even though it is not very prevalent and it is relatively a smaller community. It is better to enter into it right now and work into it, because it is going to grow. It is something which is going to grow when there is more awareness. If we are able to learn and create awareness about all the myths that have been spread around an epidural, and change that and convince patients about pain-free labor, I think this has got a huge scope.
Actually, this has a very good, future scope. I remember one of my subscribers had come to me with the same plan. So what is happening now is there are standalone corporates coming up for obstetrics,
Yes, sir.
like
Yes, sir.
Cloud9, Bangalore, Motherhood, Rainbow.
Motherhood. Yeah.
All these are clicking than corporate
Yeah.
hospitals, like multi-specialty.
Yes.
Why are they clicking? Because
Ye-
they're branded. They branded in that
Yes.
area. So it's a no-brainer for a person and to just directly find some rainbow or motherhood nearby and they'll conduct the delivery there. So that is why what is
Yes, sir.
happening is 80 to 90% of the deliveries, like by default, they're going there. So these
Yes.
multi-specialty hospitals and other specialty hospitals are not clicking in obstetrics and gynecology areas because they are not
Yes, sir.
branded, no. So
Yes.
this is the good, this kind of business model. What happens? A lot of hospitals would enter this model. Like
Yes, sir.
so many companies would come enter this model, and they would require guys like you. Oh,
Yes, sir.
specialized in it. Correct. No, they wouldn't hire me as a neuroanesthetist. What would I do there? So they will hire
Yes.
obstetrics and gynecology trained person.
Yes, sir.
And then you'll
Yes,
have
sir.
a good career growth there. You can publish papers there. You can become a
Yes, sir.
leader there. You can head one unit. And then if you're heading
Yes.
one unit, if you're doing a good job with, publications and leadership, then two, three units, they might give you as a director. And then, so Dr.
Mm.
Ridima, director of, obstetrics, like that you can
Yes,
plan in
there is a
future.
long way to that, but that is so, sir. That's what I thought. That obstetric anesthesia is something. Also, sir, I feel like it is a very immediately rewarding job because within the minute you give the anesthesia, the labor, the pain is gone. So first thing is that you see your patients comfortable. Then it's a very happy environment because the baby is being delivered. It's a very positive environment. So I felt like that was something which is it's a good way to start your day on a good note, on a happy note. It is stressful because you'll have emergencies at night, you'll have cases at night, deliveries, extra, everything, all that will be there. But then I felt like this is something where there's a lot of scope to grow
Yes,
today.
action point. Because what
Yeah.
happens is usually most of these standalone hospitals would have visiting consultants rather
Yes,
than
sir.
having a fixed teams. Like 10 to 15 visiting consultants would be operating in one center. So the slots would be always full. So you have to finish one
Yes,
section
sir.
quickly and take up the next case, take up the next case. So it would be
Yes, sir.
that way.
So it'll be fast paced. Yes,
Fast
it
paced,
will be
yeah, action.
fast paced and also something where you don't really have to convince the patient to convert to into surgery.
Yeah,
So that is never going to be the struggle of the surgeon. So you are never going to have lack of work. Like if you're doing a spine case, for example, you would definitely know better. But I'm sure that surgeons really are struggling to convince patients to undergo a spine surgery today because the general notion in the public is whatever happens, don't go in for a spine surgery.
yeah,
In fact, that is for every surgery. That though there are so many inhibitions that patients have that they try to postpone the surgery till it is absolutely unbearable for them, right?
mm,
So surgeons struggle to convert patients to come onto the table. That is not our concern actually, because we are going to only attend to them once they are on the table.
yeah,
But somewhere there might be days where there is dearth of work for us also, because now case is cancelled, patient is not coming in, they have chosen not to do it, they've opted out of it. So somewhere you also might end up having a little more free time. But in obstetrics, I felt like there is no choice. 9 months into it, there is no question of convincing the patient for anything that way. So I felt that would be something where there'll be continuous work, lot of work. So it would be something which is going to and grow. There's scope there basically. So relatively smaller community also is what I understood. So I thought it's easier to
then
work
you
through
come
that.
to Hyderabad, I think. Fernandez Hospital is there. That is very,
Yes, sir. Sir, that is in Hyderabad. Yes, that is very good. Under Dr. Pandya. Yes.
yeah,
Yeah, yeah.
super.
So that is the eventual plan. Their fellowships open in July, August. So I've missed it for this year. So maybe next year I'll apply for that.
You can take it slow in life, no problem. So there,
Yes, sir. That is the plan right now. Little parents, family is asking me to focus a little bit on my personal life also. So I said, okay, take some time off to do that as well.
yeah, yes.
So yeah.
So anything else you would like to, to conclude to the aspirants who want to settle in UK after, a PG?
Yes, sir. I think this is a personal choice. I think what I want from life may not be what everybody wants from life. It is an absolutely personal decision. But if you are thinking of work-life balance, yes, it is. I don't feel like there is work-life. I wouldn't put it like work-life balance over there. Again, but my understanding is only of my experience of 2 months. So this probably might not be an entire perspective also, but what I understood is there is no escaping work. For me, being in the kitchen is also work, doing housework is also work,
Yes.
being in an OT is also work, and you have to choose what you want to do. I feel like also when you go there and you don't have your family and things like that, you start realizing how important that support system is as well. Second thing I felt is it is a country which is never going to be your own country. So no matter whether you end up settling there, you grow into their practice, they are extremely welcoming as people. I had a brilliant time with the people there. They were extremely helpful. They were very open to knowing how we are functioning in this part of the world. They were telling me how they were working, their experiences, things like that. But I still somewhere, it's not home,
Yeah.
it's not your home ground. So for me, I felt that I'd rather use my skill set for my own country, which recognizes my journey so far. I've spent 6 7 years training in anesthesia in this country. Why not that my people should benefit from my journey? It is not that I don't want to serve anybody who requires, that's fine, but it's not that our country doesn't require doctors. They do require doctors, in fact more now than ever. So
That's
I felt a little bit patriotic feel also comes when you're not in the country. Then you start feeling that you want to do everything for your own people. So I didn't face any racism or bullying or anything over there. People were extremely nice to me. They were very welcoming. They were very supportive of the fact that I took a decision like coming there for an observership. So they really recognized that as a good step to take a calculated decision and a well-informed decision for the future. Uh, so that was also something where I felt like this is not going to be your own country ever.
uh,
Uh,
my opinion. I would tell what decision you have taken is actually a good decision because
yes, sir.
I'm actually writing a script for a video called "The Golden Period is Coming." So for
Yes, sir.
Indian doctors mainly, and that
Yeah.
video will release in a few weeks. Yeah, I
Okay.
recommend all my subscribers to watch that. After watching that, you will say that the decision taken by Ridima is the best decision
Yes, sir.
because there are certain factors which are going to change in the next decade, and
Yes, sir.
luckily we are coming into that golden period, and hope we
Yes, sir.
will, get benefited.
Uh, Yes, I feel like situation was very different probably 10 years ago. But today, we have facilities which are accessible to most people in this country, which are at par with what is happening in the West. So if you're sitting in India and you're feeling that you're missing out, which is what I was feeling before I went there, I would like to tell your subscribers, don't feel like that, because you are not missing out at all. In fact, you are at par with people who are in the UK and in the US. It is just that 10 years ago, maybe we were not there. So, and we have improved. They are still where they are. It is not that they have leveled up, but India has leveled up. So that is why today the situation is not the same as what it was 10 or 15 years back when our seniors and our consultants went there. That time, yes, there was a great difference. When you went there, there was too much to learn, there were many new things. Today, not as such. Today, everything that they're doing there, we are doing here, and we are doing an equally good, if not better, job. So I felt that nobody should end up feeling. I came back and I told all my colleagues also that if we are in India, we should not feel that we have not achieved something or that we are underdogs or we are underplayers. That is what is painted by the West. It is always considered that the West is the place to be for medicine and for research. But today I don't feel that. Today, after I've had this exposure for 2 months, I feel that this is actually the place to be,
Super.
because today we have everything that we can do for our patients that they are doing for their patients.
And many people are asking a question about after diploma, can we go to UK? I did the research for that and even called some of my friends there. After diploma, you can write IDAC and diploma holders are eligible
Yes,
to write IDAC. And after that,
yes, sir.
they can actually get a GMC and they can apply for these jobs. But they require years of experience because they expect at
Yes,
least 3 to 4 years of training experience. So they might have to
yes.
stay for another 1 2 years and then they have to try.
Yes,
Correct, no?
sir, with the diploma, I also wanted to add, if anybody is interested in the MEd program which is conducted by the Edge Hill University, they are eligible for that as well.
Directly.
So, yes, directly. They are eligible for that as well. So, but for MTI, you will require to show six posts which get covered only with an MD degree, because
Mhm.
6 semesters basically. So that gets covered with MD, but with diploma, you do only 4 semesters.
Got it.
So with diploma, you cannot apply for an MTI. You need to show 6 semesters of training.
Okay, after diploma, if I do IDCCM, then because
Sir, that I'm not sure. That I'm not sure how that works, because I did not explore the ICU aspect of it. But I know for sure that after diploma, which is 4 semesters, you cannot apply for MTI, which is also why I was very motivated to do DNB. Because when you do a DNB after an MDA, it becomes 8 semesters. So you have already crossed that 6 semester target requirement for their applications. But anyways, now that's like become, the MTI posts are very less in very few trusts. So that, and that also, it is all managed. So whether you'll get or not is also a questionable thing. But for for the MEd program, you can apply through post diploma with 4 posts also, 4 semesters also. So
okay,
somebody who is affording and really wants to go and wants to go immediately, that's the fastest way to go. Then they can, after diploma, apply for MEd. That is the fastest way to go there.
super. And then fellowship, if somebody does in India after MD, for example, now you're planning to do obstetric anesthesia with
Yes.
somebody based ward. And then after that, can you get the same job there, like obstetric anesthesia or something like that?
Sir, your chances are better, but again, you will lose out on the GMC aspect of it, because you don't have a GMC number. So
Mm.
your form probably might not get forwarded only. If it does get forwarded, if you're lucky, or you email some consultants directly and you inform them and send them a resume, and if they look into it and they get back to you, if that is, or there is some communication with people there to help you out, maybe then it might be and they have the license, they should have the license to sponsor you also, that particular trust. If that particular trust has the license and you can manage to get your CV ahead without the GMC number, which is the first struggle, then yes, definitely a fellowship helps. But so to speak, they don't consider Indian experience very highly.
Okay.
I don't know what is the reason for this.
That is a
Though they
system
have
existing.
shortage,
We are tier three country.
but sir, that is also there. What the consultants told me while I was there was that our training duration is very short
Mm.
as compared to theirs,
Oh,
which is why they don't feel that the training here might be equivalent to theirs. In fact, Sri Lanka, Pakistan, they recognize those countries' degrees because they have a similar duration. Sri Lanka anesthesia MDA is seven
4 years.
years.
4 years.
So four, maybe four then, but they 4 or 7. I think somebody was telling me it is 7. I'm not very sure. But it is more than ours. So that is probably the only distinguishing point, because but they don't realize that we have more numbers.
Mm.
So what they are doing in 7 years, effectively we are doing in 3 years. But I think duration is where we lack. So they don't include Indian experience. They don't take it very seriously.
And the logbook, did they ask you, like anybody, did anyone, any trust ask your logbook or anything? You're not
No,
gone?
sir, they didn't ask me for to show the logbook, but they when I went there and we were doing cases, they would ask me what kind of cases I have done, what is the anesthesia we are giving. So there would be a lot of interaction and case discussions, and they would teach their trainees. And at the end of, I was also allowed to attend those lectures and everything. And then at the end of that experience, they would ask me that in India, how are you doing the same case? So then I would, if I have done the case, I would tell them that this is how I have done. If I have not done, I would tell them that I haven't done this kind of a case there. So there was a lot, they were very open to knowing what is happening here. So yes.
Superb, superb, very good. And then the last question is, you told that you can directly mail the consultants and all that. How to actually get those email IDs, or how to?
Sir, for email IDs also, yes. So when you go on to NHS jobs and you are applying for the post, at the end of the form, they have a consultant. Suppose for anesthesia, because I was applying, they would give the consultant's email ID, who is the course coordinator. So if you have any query, you can email that course coordinator. So from there, I would get the email IDs. After at the end of each form, it is given every contact person for that job, for that particular job, they give the email ID. So you can email on those IDs, and they are all NHS .uk IDs. So they are the registered hospital IDs. And so that is how I started gathering all the email IDs of all the consultants, and I started cold emailing them, which is something I found as a technique while I was researching as to how to reach out and make my CV visible to people so that I can land an interview. And one of them happened to be very kind and reply to me, and then this entire I requested for an observership. The observership process also works such that the consultant in the department has to give a go ahead that they are happy to take you under their supervision for observership. They have to inform the HR of the hospital about it. Then the HR starts the process, and you have to make the payments and submit a lot of documents which might be required: police clearance checks, good standing certificates, all of that would be required. You do all of that paperwork, and then they send you a license to attend for that particular period, whichever you have decided with your consultant. So if you want an observership also, you will have to get in touch with consultants over there,
Good.
which you will get through these track jobs. You can get the email IDs, or if you have friends working there, seniors working there, and they can help you get numbers or email IDs of the managers, then you can probably, or consultants, then you can probably contact them.
Got it. Super. So I think then we have, so with your limited experience, whatever knowledge you gained,
Yes, sir.
you told the subscribers, and the decision also you told us. But in future, if you
Yes, sir.
change your decision, you let us know. If you're going, we'll make part two
Yes.
of this video that time.
Yes, sir.
If you're
Yes, sir.
not going to
Sure,
UK
sir.
again,
Sure.
it will be the part two. If you
Yes.
change the decision.
Yes, sir. Yes, sir. It's always a pleasure to talk to you. I'll be happy to make any house as many parts as you would like. Yeah.
Okay. Thank you, Ridima.
Yeah.
Thank you. Thank you,
Thank.
guys, for watching the video till now. Bye bye.
Yeah.
Thank you.
Thank you, sir. Bye bye.